Hello, I'm Dr. Fahim Khan. I'm a rheumatologist and provide Calmare Therapy. I'm based in Ottawa Hospital in Kilkenny, Ireland, which is based in the southeast of Ireland, where I practice as a rheumatologist and also provide the Calmare treatment, which is FDA approved device for the treatment of pain conditions. So first of all, I'll just introduce you to what is Calmare Therapy. Calmare is a name taken from Calmare, Italian word, which means soothing. So it was invented by Professor Marinio in Rome, Italy, who named this device as Calmare, soothing or easing of pain, which, as the name implies, it treats many pain conditions with excellent results without the use of drugs or medication. So there's no drugs, medications are used to treat pain with this device, Calmare device. Calmare Therapy has an FDA approval, so FDA approves this treatment. This machine is FDA approved for neuropathic pain, cancer pain, and many other pain conditions. So neuropathic means nerve pain, neuropathy, and there are many nerve conditions or neuropathies which are quite resistant to treatment, including complex regional pain syndrome, which is called CRPS or reflex sympathetic dystrophy, or chemotherapy-induced peripheral neuropathy, CIPN, shingles or herpes zoster neuropathy, diabetic neuropathy, trigeminal neuropathy. So many different types of nerve conditions are treated with this condition with excellent results. We see results of over 90% success rates for RST, CRPS, chemotherapy-induced peripheral neuropathy, CIPN. So it's a great treatment for patients who have these unfortunate conditions. Now there's a treatment, you could say there's a cure available for it, because for these type of neuropathy, particularly complex regional pain syndrome, there's no known cure. Patients tend to go on different types of medication, but unfortunately they continue to have pain. So now we have Calmare Therapy available. And if you look at the success rates in centers which provide Calmare Therapy, particularly in the US, we see over 90% of patients do very well with the treatment. So excellent response. And I see that in my clinic as well in Ireland, where we have patients who have over 90% success rates achieved for these conditions. This treatment, unfortunately, is not that widely available in Europe, and I'm the only sole provider of Calmare Therapy, because in the beginning when this treatment was approved, I knew this treatment would help patients, and I got this treatment available in Ireland. Initially it was approved to be used for numerous pain conditions. So since 2011, I've been using Calmare Therapy for, you could say, over 9 years. I have patients treated with this Calmare device for numerous pain conditions. So apart from neuropathies, patients who have back pain or pain radiating from the back going into the legs, which is called sciatica or lumbar radiculopathies, and that's also treated with Calmare device. And some of the patients who have had spinal pain injections or back surgery or failed back surgery, this is a wonderful treatment for them. Other condition would be neck pain, and patients who have fibromyalgia, which I see quite a lot in my rheumatology clinic, patients presenting with fibromyalgia. So thankfully, this condition has helped many patients with fibromyalgia, which is a condition with generalized pains, fatigue, tiredness, and pain relief is achieved with this device without the use of drugs, medications. And they have long-lasting pain relief. That's another plus point. Patients who have cancer, these patients also are treated for pain relief with Calmare device. So how does Calmare treatment works? The Calmare machine produces pain-free impulses. So these electrodes or EKG, ECG type of cables are attached to the patient's site of pain, and the pain impulses travel through these electrodes or cables from the skin to the body tissues, down through the nerves, through the spinal cord, into the brain, blocking your pain and giving a pain-free impulses. So these pain-free impulses generated from the Calmare device, and as you can see on each session, we have up to 5 electrodes are there, and 5 different parts of the bodies which have pain can be treated on one session, one go, with a Calmare device. So the impulses generated from the Calmare machine blocks your existing pain by traveling through the same nerves that transmit the pain up to the brain, blocking or overriding your existing pain. And the brain switches over to the new pain-free impulse, and thus there is immediate pain relief. And that we have not seen it with many painkillers that patient would take. So this has immediate effect on pain relief. But to have more long-lasting pain relief, Calmare sessions are given, and up to normally 10 sessions of Calmare therapy are given. So normally we start with, let's say, Monday to Friday or Saturday, maybe say weekend off, and then by the next week the patients are finished with the treatment. Excuse me. So up to 10 sessions of treatment. But some patient with resistant pain, the sessions could be 2 more, 12 sessions. And each session, the duration of treatment varies from condition to condition. Well, let's say I'll give you an example of patients who present with neuropathic pain. We give 45 minutes of each session. It varies from patient to patient. And resistant cancer pain, up to 60 minutes of session can be given as each session. Somebody with neck pain, back pain, up to 20 minutes of session can also be given. So it varies from condition to condition and so on. So once the treatment is over, we expect the pain score to improve considerably. But if, let's say, for whatever reason, if the pain comes back, which we see in probably 5-10% of patients, then a couple of booster sessions can also be given. So it certainly depends from condition to condition, but neuropathic pain improves greatly with this treatment. We have also seen very great improvement with patients with fibromyalgia, and similarly with back pain and things like that. So it's a wonderful treatment that is available to treat pain without the use of drugs, without the use of medications, with no side effects at all. So this treatment is free of any side effects. When the treatment is on, there is no pain felt as well. So the treatment is literally pain-free. When we attach the electrodes to the skin through the ECG electrodes, we use the ECG electrodes device when they're attached to the skin through these disposable electrodes. So I'll just show you how these are the EKG electrodes. So let's say we place those electrodes away from the site of the pain. If I'm treating my arm, so one would be attached there, the other could be attached to the, let's say, of course I have to expose my arm, and we place it here on the skin. So when the treatment is switched on, when we switch on the treatment, the patient normally feels a little bit of this tingling type of sensations going through, which is fairly pain-free, bearable. So you don't feel any pain, and we can always control the frequency of sensation with reducing the frequency to the level that is fairly tolerable for each patient. So the treatment is literally pain-free. So that's a plus point about this treatment as well. So guys, there's a treatment available, excellent treatment. It's pain-free, great results. It's available I've used it as a rheumatologist for a very long time. I see patients with back pain, neck pain, myofascial pain, muscular type of pains, fibromyalgia. I see patients who present with neuropathic pain. Some patients with, have been presented with chemotherapy-induced peripheral neuropathy. They have neuropathic pains. So they have all been successfully treated with this Calmare Therapy device. If you look at the treatment protocols after the treatment is over, we leave the follow-up appointment very much at the discretion of each patient. And if, let's say, your pain scores comes back, which can happen in 5% or so of the patient, or 10%, we can give them a couple of sessions to control the pain. So the patients are totally free of all these very serious pain drugs, which have potential for toxicity, side effects, dependence, addiction. Unfortunately, many deaths have occurred in countries where narcotics are used, particularly in US, things like that. So patients are taken off all these medications and they are free of all the drugs. So that's a plus point about this treatment. So if you have any questions, concern, you can always email me at rheumatologyclinics@gmail.com. So that's the email, rheumatologiclinics, rheumatologyclinics@gmail.com. Or the website with more information on Calmare Therapy. Our website is www.arthritisandpainclinic.com. Coming to Kilkenny for the treatment. Yes, Kilkenny is a beautiful city. It's located in the southeast of Ireland, so-called the medieval city. We have many hotels. Accommodation is not a problem. It's a touristy city. And there are beautiful castles, cathedrals, there are nice walks. There's historical places here. You have the medieval streets here in Kilkenny. So it's a beautiful city. You'll certainly enjoy your trip coming with your family member and staying in nearby hotels. So we have no problem from accommodation point of view. Any patient who wants to have the treatment, my secretary would be more than happy to organize the slots for the patient. We normally accommodate them as per the patient, their timings, things like that. And the patients are very happy when they are here in this city. Their loved one is being treated. And we see a smile at the end of the treatment who have presented with severe pain. And that's a joy for us. So any questions, concerns, please do not hesitate to contact me. Thank you very much. Thank you. Bye-bye.